I do. In November, you said that we are the most transparent jurisdiction in North America when it comes to releasing COVID-19 data. Since then, we've heard a lot of concerns about specific areas where we are not releasing data. A letter was sent to you from the opposition today or earlier this week asking, or actually to Minister Dix, asking for more transparency. I want to ask specifically about the transparency when it comes to schools. Do you believe we are doing enough to inform parents around the issues of COVID in schools? And should we not be providing specific information around teachers, students, and spread in classrooms like we're seeing in Ontario and other jurisdictions?
Well, again, we have done our best to make sure that we have a school-by-school, district-by-district approach to the K-12 system. There's been successes, overwhelming successes in many parts of the province and some challenges in others. In terms of transparency and distribution of information to the public, we have done the best we can to make sure that those that need to know do know. But creating hysteria when there may not be a prospect of transmission is what we want to avoid. And we also want to protect people's privacy. We do not want people stigmatized. This is, I think, a good opportunity for me to raise the example here very close to my community, an area that I used to represent in the legislature, the Cowichan tribes, who are being treated absolutely appallingly by community members because they have been identified as potential COVID patients. That's not what anybody wants. But if you're starting to point to individuals and saying they have COVID-19, that stigmatizes individuals, it stigmatizes children in some cases. We want to make sure that people who need the information get it, and we've been doing our best to ensure that that happens. I look at other jurisdictions, and the case count numbers would tell us that whatever they're doing is not as effective as what we're doing. The distribution of information is guided by legislation in many cases, and also good public health practices. And I'll continue to take my advice and counsel from public health authorities on how best to distribute that information.
Regarding long-term care, BC did very well and were lauded for doing well in the first wave, but in the second wave, we've seen a quarter to a third of all active cases consistently over the past month being in long-term care homes. I'm wondering, do you need to do more as a government financially to support care workers being able to stay away when they're ill? Safety protocol refreshers, because Dr. Henry has mentioned this. I'm just wondering what your responsibility is as a government, if there's more you can do, because it's pretty devastating right now.
Well, one of the key components is going to be making sure there are more staff. If there is a positive test, that leads to disruption in the long-term care facility. That means that there are challenges in restaffing and making sure that those residents in the care homes are safe and getting the services that they need. So we need, first and foremost, we need to hire more people, and that was made clear before the election campaign, during the election campaign, and we are taking steps to increase the number of people working in the sector. That's the first thing we can do. In terms of other issues around long-term care, I know Dr. Henry and Minister Dix are focused like a laser on that. Isabel McKenzie is doing a review. I welcome that. I look forward to the information that she brings forward. But again, all of us, not just in British Columbia, but across the country, are wrestling with these issues. And asymptomatic staff may well be, we don't yet have a solution to that, and we're keeping a close eye on these issues, and we're trying to manage them to the best of our ability. And again, I don't like to, and this is probably the third time I've done it, so it doesn't sound like I don't like doing it, but I have to compare our successes in British Columbia to the United States and to other provinces, because that is where continental North America is where we need to address issues. And here in British Columbia, we're looking at best practices in other jurisdictions, and we are trendsetters in many other ways when it comes to addressing these challenges. So I'm confident and comfortable that the teams that we have in place are doing everything they can to restrict and reduce transmission, but we all have a responsibility. And again, I'm very proud of the sacrifices that British Columbians have been making, not just for a little while, but for a long, long time. And I appreciate the frustration, not just within long-term care, and of course the families who have loved ones in care facilities, and the courageous heroes that go to work every day in our healthcare system, despite the risk to themselves. I think we all just need to keep focused on that relative to other jurisdictions, British Columbians are doing extraordinary things every day, oftentimes going without reporting. So although there are certainly lots of examples of where we can make improvements, we'll continue to improve in those areas, but I think we often need to pause and celebrate those successes that we've been having as well.
Lisa, do you have a follow-up?
I do. Sorry, fumbling with my phone here. Regarding schools, you mentioned, saying with the information that's been that's being given out, that part of the issue is privacy. But I've talked to Dr. Bonnie Henry about this, and I've been following it very closely. And she's mentioned that one of the big challenges is the data system, that the way the data system is set up, it makes it very onerous and laborious, which I think is probably why we only got this data from Vancouver Coastal Health today, because, of course, we need public health working on the front lines. So is there not something that you can do as a government to improve this data health system or the data system from schools going into health, so that this information that does give confidence to parents that they don't have access to, even if more broadly, that is more accessible to public health so they can make it accessible to parents and staff?
Well, certainly new Minister Whiteside has been immersed in these issues from her swearing in back in November, and will continue to as we come through the pandemic in the months ahead. We're having all of the Cabinet approach this with a focus. That's what the retreat that I referred to today and tomorrow will be all about. How can we take our collective energies and efforts to addressing the challenges British Columbians see, the gaps they see in our ability to fight this pandemic. But the highest priority British Columbians have is getting through this and making sure that we recover our economy in a way that makes sure that everybody benefits. And a lot of it, there's been a disproportionate impact of COVID on marginal populations, on women, on young people, people of color, and we want to make sure that when we restart that we're focusing on those issues. And in the K-12 system, again, I tip my cap to the thousands of teachers and the hundreds of thousands of kids and families who have put their faith in our K-12 system, and all of the stakeholders, teachers, administrators, education assistants, janitors, parents, everybody working as hard as they can to make sure kids are safe, because we all know that the best place for kids to be is in a classroom. And that's evident by the glee on the faces of youngsters when they see their friends. And again, many people may have had bad experiences in their school years, but if you don't have to spend too much time thinking about those happy times when you were in the K-12 system, and we don't want to rob this generation of those experiences. We want to make sure that we're doing this as safely as we can. The distribution of information is at this point as effective as it can be, but that doesn't say we can't improve upon it. And Minister Whiteside is working with public health, working with trustees and school boards to make sure that we're giving as much information as we possibly can to give people confidence that their kids are going to be safe.
As was mentioned, the province is dealing with dozens of outbreaks at long-term care facilities. Health authorities have said most of these were introduced by staff who unknowingly brought COVID-19 into the facilities, often not recognizing symptoms of fatigue or illness. We've heard the facilities are understaffed, making it difficult to implement safety protocols effectively. And also we know that many care aides cannot earn a livable wage and are working in multiple places to supplement their income. You mentioned needing to hire nearly 12 months since the pandemic began. Why is this taking so long when we knew the second wave was coming? And will frontline workers be getting pandemic pay during this second wave that is even more challenging than the first?
Well, thank you very much for the question. And again, you've sort of answered the question in presenting it. The challenges we have is that asymptomatic workers are not clear that they're sick. Many attribute their fatigue to just that, being overworked, because we need to have more people in the sector. So these are challenges that human failings, that being not being able to identify that you're sick. We've been pretty clear from the beginning, if you're not well, stay home. that has consequences in the long-term care sector because we don't have enough people. And that's why we made that a high priority and continue to make it a priority to hire more people. People are coming on stream. We need that. There's training that's required. You can't just walk in one day and say, how can I help? Although the volunteer sector has been curtailed as well because of COVID, but we're doing our best to make sure we're putting resources in place to protect residents of long-term care and, of course, to keep the staff safe and supported by more people around them.
Do you have a follow-up, Eva?
I do. 2/3 of our COVID fatalities, as we know, have been in among seniors in long-term care, over 600 people. The seniors advocate has said she will be investigating all care homes to discover what went wrong at the ones that experienced the major fatal outbreaks like Little Mountain Place, Tabor Village, Lynn Valley, and Langley Lodge. While you mentioned that BC has fared better than other jurisdictions, that's little comfort to families that have lost loved ones and seniors that have been confined to their rooms for months, and this has been a traumatizing experience for many of them. I'd like to know if your government will commit to launching a long-term care commission to look into how and why COVID-19 spread in these long-term care homes and the impact of this on the existing system as was done in Ontario.
Well, our focus right now is to make sure we're keeping people safe. I welcome Isabel McKenzie's interventions here in the cases that you've outlined, and I look forward to the recommendations she brings forward. I think it's premature at this time to talk about commissions. I think we need to focus on vaccinations. I think we need to focus on making sure we're building new long-term care facilities to do away with 4-person rooms, to build a modern long-term care structure that will meet the next generation's needs. That's our priority today, and we'll be informed by the work of Ms. McKenzie and others to get us there. But at this point, I'll await the next number of months and advice and recommendations from Minister Dix and public health officials, as well as the health authorities and the operators of the facilities, who will give us a better understanding of where we need to go. But I think it's premature for me to say today that that's the direction we're going to go.